Hi, I'm Anisha Linville, and today I'm going to be completing my assignment, which was what is the difference between Medicaid and Medicare in a state of my choosing, and I chose Maine. So what is the difference between Medicare and Medicaid? I was supposed to answer 3 questions, being who gets selected and what is covered for Medicare or Medicaid. Question 2 being, what is the scope of the whole program? So is it a state-wide kind of thing? Is it national or is it a local thing? And then number 3 being, how are they different in the state I chose? How are they different from one another? Okay, so answering question 1, who gets selected and what is the program? So for number 1, Medicare in Maine is a federal program covering most seniors 65 and plus. That would make you eligible for it. And then some people with disabilities, with benefits including hospital stays, doctor visits, as well as some prescription drugs, meaning it won't cover everything or cover a type of like a specific kind of prescription drug, I guess. I had a friend who worked at a pharmacy in Seymour. Like, I don't know if it's like a pharmacy tech, but I know that you could job shadow there possibly, and my high school had like this big program for it. And she talked about often like how some people would get frustrated over that not covering certain prescription drugs. Okay, and then Maine, for Medicare or Medicaid in Maine, they have a program called Maine Care. So Maine Care provides free or low-income cost health insurance to eligible low-income residents, including children, low-income adults, pregnant women, and also elderly and people with disabilities. Sorry. It covers from a range of things medically necessary services. Excuse me, I'm like chewing my words. Those include doctor's visits, hospital care as well, prescription drugs, dental care, mental health services, so like therapy, counseling, and medication, and then long-term care, so nursing home care, and assisted living. And then also, I found this one really surprising that I found family planning services, so reproductive health care and contraceptive. And then lastly, child health services. So you can bring your child there for wellness exams, immunization shots, and kids with like asthma. Okay, and then for question 2, which was, what is the scope of this whole thing? Like, is it national? So Medicare is a federal insurance program within Maine, and then, not within Maine, so it's like a government-owned program, I believe. And then Medicaid, so Maine Care, would be a joint in-state program, so they're combined. And then question 3 being, how are they different from one another in the state that I chose? So from maine.gov, I found that in Maine, Medicare and Medicaid serve different purposes, with Medicare being a federal program for seniors and some people with disabilities. Maine Care is a joint federal state program providing health insurance to low-income individuals of all ages. So Maine Care, aka Medicare, it doesn't have an age limit, as in like how what's it called? Not Maine Care, but Medicare. Medicare, you have to be 65 plus. It's really for older people with disabilities. But for Medicare, there's no limit, especially since I mentioned before you can get immunization shots for your children. You just have to be eligible for all of it. You can even get the wellness checks too. So all in all, there are big differences in Medicare and Medicaid within Maine, especially since they have a Maine Care. I think that it's really important, especially if you live in the state of Maine, you check it out if you think you are in need or want to know if you meet the criteria. I found all my information from maine.gov. Yes, so thank you.